are a pregnant woman and you are planning to start exercising, I would advise you watch this video. And also, if you are a pregnant woman and you are not staying active, I will also advise you watch this video. Hello everyone, I am currently expecting and I have decided to share my thoughts, my experience and my knowledge on the benefits of staying active during pregnancy. Personally, as an individual, I like being active. I like exercising. I just like getting busy because I know the importance of staying active. So during the course of my pregnancy, I really wanted to continue this because I have been off work and I started my maternity leave on time. So being off work, always at home, so staying active is something I really want to continue. It's not something I just want to drop down. So I'm going to be sharing with you my thoughts and experiences. I'm going to be telling with you what tips you need to know when you are exercising as a pregnant woman, some safe exercise as a pregnant woman, and also the benefits of staying active or exercising as a pregnant woman. For those that don't know me, my name is Nurse Mercy Mary, and on this video, Nurse Mercy Mary is pregnant. So firstly, I'm going to be talking about the benefits of exercising while pregnant. But before I tell you this, I just want you to know that not everybody are fit to exercise during pregnancy. So it's advisable for you to get your doctor's approval. Some people may not be capable of exercising during pregnancy because of some underlying medical condition, past medical history, or surgical history, or things like that. But feel free to get your midwife or your doctor's approval before exercising. Now let me take you to the first point, which is the benefits of exercising. And that first point I want to share with you is that when you exercise, you boost your energy. You will agree with me that with pregnancy, as a woman, you are always fatigued, you are always tired. But with little exercise, you tend to improve your overall circulation, your overall blood circulation. You tend to improve your oxygen intake, your oxygen circulation. And when that happens, definitely there's going to be a boost in your energy. All right, so that is one of the benefits. Personally, I noticed that when I don't exercise, I feel more tired. I feel extremely tired. But when I get out of that my tired or that my fatigue pregnancy safe to exercise, my energy level increases from 0 to 100. But when I wake up and I am extremely fatigued and I don't exercise, it remains maybe from 0 to 20. But if I take it if I take it seriously, my energy level tends to increase. So whenever you exercise, you actually boost your energy level. And then the second one I have to share with you is that it helps to boost your mood. Yes, it helps to boost your mood, those mood swings that comes with pregnancy. When you exercise, it helps to boost it. Why? Because when you exercise, there's a release of a hormone known as endorphins. And endorphins help with mood boosting. And when those hormones are released, it will help you to manage stress and anxiety associated with pregnancy. The third point I have to share with you is that when you are active during pregnancy, you are exercising, it helps to reduce pregnancy discomfort. We all know that with pregnancy, we are usually prone to having a lot of back pains and all that. But with exercise, it tends to help you improve your flexibility. Yes, and when there is flexibility, it helps to strengthen your muscles. That is likely going to help you reduce that back pain and also those discomforts that comes with pregnancy. Then the fourth one I have to share with you, and I am a living testimony of this particular one, is that it improves sleeps. Especially when, like this period I'm in my third trimester, close to the end, where insomnia is like the other of the day, I find it difficult to sleep. But I notice that the days I wake up, I exercise, I am active, I find it very easy to sleep. Unlike the days I just stay on bed all through. So on the long run, when you wake up, you feel exhausted, you don't want to do anything. Try if you can, and your doctors approve it. I would advise you to get up and exercise and stay active because it's going to help you during the night time. Because during the night time, I find myself thinking about, what's the outcome of the pregnancy? How is it going to look like? A lot of things just cluster through my mind. But when you exercise during the day or before you go to bed, because now before I go to bed, I do a particular exercise before I go to bed. So that actually helps me sleep very well and longer. So it actually helps for what? For better sleep. And the fifth benefit of exercising during labor is that it helps prepares you for labor. Yes, because when you exercise, especially the Kegel exercise, which I usually do before I go to bed, and this mild circuit I usually do before I go to bed, it actually helps prepare you for labor. It helps to strengthen the muscles. Kegel exercise, it helps to strengthen the muscles before you put to bed. So when you do exercise, it helps prepare you for labor, and it makes labor and delivery easy compared to when you're not exercising, and also when you are not active. So now we're going to be talking about safe exercises that are good for pregnant women, because as a pregnant woman, not all exercises are good for you. You don't just go and start lifting heavy weights. You don't just go and start doing those, you understand, those difficult jumping and all that. So personally, I'm going to be listing the one I did. So I usually take a walk with my daughter every morning. So after our normal routine, like she bathes, she eats, take breakfast, then we take a walk. So during that process of taking a walk, I am exercising. So I don't necessarily need to lift heavy loads in order to stay active. So taking a walk is one of the easiest way to exercise as a pregnant woman. Then the second one I want to share with you is Kegel exercise. For those that don't know about Kegel exercise, I would advise you browse about it. You're going to get more information about what Kegel exercise is and how you can do it. Kegel exercise is very, very important when it comes to labor and delivery, because it helps to strengthen your pelvic floor muscles in preparation for delivery. Then the third point I want to share with you is the prenatal yoga. Prenatal yoga helps you to stretch, helps to increase your flexibility and all that. You can also try that. Those are the three exercises I usually do. Outside walking, I do this treadmill. You can see I run, but it's in a very, very slow pace. My husband usually do 50 something, 55, but I do just 3. You can see the difference. So I'm not running very, very fast, just a slow pace. I put it in 3. Is it 3 kilometers per hour? I don't know, but the numbers, I put 3, my husband put 55. So you can see the difference. So this actually helps me, especially now the weather is cold and going out is becoming more difficult. So you can just run on your treadmill. It's going to go a long way to actually help keep you active. You run as your strength can carry you. Okay, so after that, I think this is the fourth one I want to share with you is swimming. I don't know how to swim, but I will encourage those that know how to swim can just do some light swimming. Then also light lifting of weights. If you know you are good with weightlifting, there are some things you can just lift, like you do as your power can carry you. But this is my husband, so it's actually very heavy. I can't. Like, it's heavy. So this is my husband, so it's like 50. This is 10 kg. 10 kg, but I can't lift it. I can no longer lift it. But before pregnancy, I think I can lift it very well. But now I don't lift it. So if you have lighter kg, like 2 kg, 3 kg, you do it and you are consistent with it, it can help with the muscle tone. But I did not do it. Okay, so it all depends on what your strength can carry you during the course of your pregnancy. So this particular one is 10 kg. So these are some exercises you can do instead of you not to do anything at all. So what I advise is just take a walk. You get, if you have a treadmill in the house, take a walk on the treadmill, time yourself and do that 20 to 30 minutes a day. It's not how fast it is. It's just the consistency of you being active, of you being moving, that actually matters a lot. The days I exercise, that's the day I feel more active. That's the day I feel more alive. I can play with my daughter. I can do a lot of things. But the days I don't exercise, trust me, I'm as good as, I don't know the words to use. Okay. So then the next point we're going to be talking about, the next thing we're going to be talking about is the tips for pregnancy, the tips you should take note of when exercising during pregnancy. So when it comes to the tips or things you should take note of when exercising as a pregnant woman, the first thing I would advise is to contact your healthcare provider. You don't just start exercising, or you don't just start doing what is bigger than you while you are pregnant. You have to consult your healthcare provider, your doctors, before starting or continue a particular exercise routine. It's a very good start. It's a very good way, especially if you have a lot of some medical histories, or you have a lot of things associated with your pregnancy, or you're having complications in pregnancy. So the second thing you should take note of is do as your strength can carry you. Don't do more than your strength. Okay, do what you can do. Listen to your body. Yeah, I think that's the right word. Listen to your body. When your body says stop, as a pregnant woman, stop that exercise. Okay. And when you start, for example, you can do 20 minutes. When you start, you don't just go for 20 minutes. Step by step, you can graduate, you can increase, depends. But one thing you should take note of is that you should listen to your body. So the first one I said was that consult your doctor, consult your healthcare provider. The second one is listen to your body. It's very, very important. Then the third one I want to share with you is always stay hydrated. Remember, you are exercising. If you don't stay hydrated, you are going to be dehydrated, and dehydration is not good for you, and it's not good for your body, it's not good for your blood circulation. So while exercising, it's advisable you have water around you. So I'm in my house, I always drink water, so I don't need a bottle. Sometimes I measure the amount of water I take a day, but sometimes I just neglect it. But make sure you stay hydrated while exercising. Then the fourth one is wear comfortable clothing. Yes, to avoid any form of injuries, you have to wear comfortable shoes so you don't fall. Then the last one I want to share with you is that make sure you take note of the type of exercise you're doing. Any exercise that there is a high risk of you falling down, you have to avoid those exercise. Any exercise you have to lie flat and start lifting, like I earlier said, don't lie flat because there's a risk, you understand? So any exercise that puts you at risk, it's advisable you stay away from them. So these are the tips I have to share with you when it comes to exercising during pregnancy.